Assalamu alaikum. My name is Hafiza Sharia Parvez and my roll number is BP1250080. This presentation is being submitted to Ma'am Shahana and the topic of presentation is Methyldopa. Introduction. Methyldopa is a selective alpha-2 agonist which converts into methyl norepinephrine centrally to cease adrenergic outflow from the central nervous system. Its use is limited because it has some side effects. Methyldopa has safety record in management of hypertension in pregnant women. Thus, it is the main use of it. We primarily indicated this methyldopa as an antihypertensive agent in pregnancy. Contraindications associated with this drug is chronic kidney disease, acute hepatitis, active cirrhosis, therapy with monoamine oxidase inhibitors. Side effects included are sedation, lethargy, postural hypotension, dizziness, dry mouth, headache, and rebound hypertension, although these may decrease with continued use. Other significant side effects include hemolytic anemia and hepatitis. A Coombs positive hemolytic anemia occurs in less than 1% of patients, those who are receiving methyldopa. Nightmares, mental depression, vertigo, rapid weight gain also occurs. With long-term therapy, patients may complain of persistent mental lassitude and impaired mental concentration. Dose, dose variation and adjustment. For hypertension, we initially start with 2 mg per oral Q8 to 12 hours for 2 days, and it may increase Q2 days PRN as per the requirement or as per its need. Okay, the dose for IV is different and for oral is different. For hypertensive crisis, the doses are different as mentioned. And for pediatric patient, the initial dose is 10 mg per kg in 2 to 4 daily doses, maximum up to 65 mg per kg or 3 grams daily. For renal impairment means the patients who are having some problem with their renal clearance, creatinine clearance. So we have to adjust the dose in such patients, and the adjust dose frequency with renal impairment are as follows. If the creatinine clearance is less than 50 milliliter per minute, so you have to give the drug Q8 hours. If the CRCL means the creatinine clearance is 10 to 50 ml per minute, so it would be Q8 to 12 hours. If the creatinine clearance is less than 10 ml per minute, so you have to give the dose Q12 to 24 hours. Drug interactions. Methyldopa has drug to food interactions, that is with vitamins, irons, calcium, fish oil that contains omega-3 polyunsaturated fatty acids, and it has drug to drug interactions as well. Like the drugs are listed here in the table: furosemide, atorvastatin, metoprolol, cetirizine, valproic acid, diphenhydramine, acetaminophen, montelukast, levothyroxine, acetyl salicylic acid. Uses rational and irrational. The rational use as methyldopa is recommended as first line agent when hypertension is diagnosed during the pregnancy. Means it is safest. It has been extensively evaluated to be considered safest in pregnancy. Irrational use, methyldopa use in treatment of essential hypertension is not recommended in view of the availability of more evidence of efficacy and safety of other drugs. Means we have some other drugs that are more effective and more safer than methyldopa, so that's an irrational use. We have some alternatives. The drug alternative is labetalol, which we use as an alternative in treatment of pregnancy-induced hypertension. If the pregnant woman is have some history with methyldopa or due to its side effects, we could not give the patient methyldopa, so we would use labetalol, that's in drug alternative. And we have some brain alternative as well, like Eldomit, which is available as 250 mg tablet in price of rupees 638. These are some more tablets, L-Dopa and Hypergen, according to the price list. The cheaper one is the Hypergen, which is of 158 rupees, and the 250 mg tablet. All of these drugs, Eldomit, L-Dopa, Hypergen, they all are available in 250 mg tablet. Toxicity reports on overdose of methyldopa are very rare. We have very rare cases for toxicity or overdose of methyldopa. In very few cases, we receive that could be toxicity. The symptoms could be hypotension, hypothermia, bradycardia, dry mouth, or coma if it's very serious. Antidote, so there is no specific antidote of methyldopa. It's usually dialysable. Treatment, if someone is overdosed with methyldopa, so we would treat with the patient symptomatically if necessary. So we will give IV infusion, may be given to excrete it through urine, and pressure agents given cautiously. Okay, so we have a case study regarding our drug methyldopa. A woman of age 29 years old was found to have hypertension during the first trimester of her first pregnancy and was started on Methyldopa in dose of 500 milligram twice daily. 8 weeks later, during a routine prenatal visit, she was found to have elevations in serum aminotransferase levels. There were no symptoms of liver disease and no previous history of hepatitis or jaundice or any exposures or high risk behaviors. Serum alkaline phosphate levels were minimally elevated, and bilirubin, albumin, and prothrombin time were normal. An abdominal ultrasound showed no abnormality of the liver or bile ducts. Serum ANA was positive in a titer of 1 to 160. She also had equivocal test for anti-HCV and VDRL, both of which were later shown to be false positives. Anti-HCV is for hepatitis and VDRL for any bacteria in blood. Okay, so we will solve the case according to some questions. What is the diagnosis? That how we evaluate what's the problem with this lady, and what is the treatment of elevated serum aminotransferase levels? What could be the reason? What could be the possible reason for positive results of anti-HCV and VDRL? So if we start with SOAP notes, subjective is the gender is female, age 29 years old. Chief complaint is elevations in serum aminotransferase levels. I would like to highlight here that the patient did not come with this complaint. It was a prenatal visit. It was a routine checkup in which they found the levels are elevated. History is that she's gravid 1 and first trimester in hypertension. History of hypertension. Current medication she is using Methyldopa, that is twice daily 500 mg, nifedipine, which is another calcium channel blocking agent, and multivitamins which are required for pregnancy. Okay, in objective, we see laboratory results of vitals. So serum alkaline phosphate levels are elevated, bilirubin, albumin, and prothrombin are normal. Abdominal ultrasound is fine, which shows a normal physiology. No pathology is seen in the ultrasound. Serum ANA is positive. The ratio is 1 to 1 to 60. And anti-HCV is positive. VDRL is positive, which later we tested again and found it to be false positives. So we assess according to the history and according to the information of the patient. Abnormal serum aminotransferase levels might be due to the methyldopa therapy, as we know that methyldopa is able to cause acute cirrhosis and acute and chronic liver injury. Its side effects or adverse effects of methyldopa. So that's the main thing we could relate to, as there is no other indication of hepatitis, jaundice, or liver dysfunction. And anti-HCV and VDRL were later found to be false positive. We have a plan to treat. First of all, we will stop methyldopa at once to see if the elevated levels are due to adverse effects, as there is no other evidence for the current situations that the patient is going through for the elevated serum levels of ANA, and check levels of serum alkaline phosphate levels after a certain period of time. After stopping methyldopa, we will again assess her levels and repeat serum ANA levels, repeat anti-HCV and VDRL tests. So there is no drug-to-drug interaction. We see the patient is currently using the like nifedipine, which is a calcium channel blocker, or using for her hypertension as an antihypertensive. Although there are cautions to take methyldopa with multivitamins as it decreases efficacy, both shouldn't be taken together. No, there is a higher risk of liver injury, acute or chronic, with methyldopa. If patient is once affected, so the drug should not be re-exposed to such patient. Means the next time when patient came, so you have to look for her history, that either she has been exposed to earlier and if it is caused any injury to her liver or acute or chronic hepatitis or jaundice or anything. So these are the references from where I have taken the material to make my presentation. Thank you so much.